See the Signs is a comprehensive system for cancer management in primary care that can support practices with the PCN DES and QOF targets for early cancer diagnosis, which will be continued in their current format into 21-22. The targets for both the DES and the QOF for early cancer diagnosis overlap and focus on adherence to NICE NG12 cancer guidelines, standardising referral practices, giving patients information leaflets, safety netting not just 2-week waits, but all tests and investigations that are there to exclude cancer, and facilitating learning and reflection. See the Signs can help you achieve all of these targets through its integrated features. Let's start with adherence to NICE NG12 cancer guidelines. You can use the risk assessment portion of See the Signs to check patients' symptoms, signs, and investigation results to NICE and local cancer guidelines using our clinical decision support tool. See the Signs will compare what you've inputted with the entirety of NICE and local cancer guidelines to ensure you're not missing anything you need to think about when creating a management plan for your patient. See the Signs will also show you if your patient meets the guidelines for the new rapid diagnostic clinic that's available in South West London. Moving on to patient information leaflets, See the Signs will provide you with any leaflets that are related to the recommendations for your patient. If there is a language option, you'll see that here. And then you can either text the leaflet to the patient or download and print it. So let's action some tests for our patient and a referral. And this brings us to the next part of the targets around standardisation of referrals. See the Signs will ensure that you have the most up-to-date form, and you can always text the leaflet at this point if you have forgotten to do it. It will fill in patient and GP details for you, as well as any clinical details you have already inputted into the tool. See the Signs will ensure that you don't miss out any mandatory fields. If you do, the tool will tell you that you have missed out some fields and highlight where they are. This will ensure that you don't get any forms bounced back from secondary care because you have not filled out all the mandatory sections. You can then save what you've done. You will then be able to see what you've done on See the Signs as a consultation within the patient notes. Anything that can be coded will be coded, including the new cancer safety netting code. Moving on to the next portion of See the Signs, which is safety netting. You can access this via the Practice Dashboard button on the toolbar. The Practice Dashboard allows you to keep track of patients who have had not just a 2-week wait referral, but any test or investigation that is there to exclude cancer, and any patients who've had to have their referral or test deferred due to COVID, for example. You can easily filter this page by referrer, dates and times, or by a specific investigation or referral. For example, you could find everyone who's due to have a fit test. You can also use See the Signs to keep on track of your patients with a cancer diagnosis. You can use this Cancer Confirm board to keep track of these patients and who is due a cancer care review. Lastly, we can move on to the section of the targets around practice learning. On the Practice Data tab, See the Signs can provide your practice and your PCN with valuable data to help you with your DES and your QOF outcomes. At the top of the Practice Data tab, you'll be shown your latest Public Health England fingertips data and the 4 main outcomes they look at. Your practice's data will be shown in the grey bar at the top of the table, followed by your PCN average, your CCG average, and the England average. If you'd like to know more about your PCN, you can open up the tab and see the data for each practice. Following on from this, you can see your See the Signs live data, not just for your practice, but now also for your PCN and the practices within your PCN. You can see how many patients have been risk assessed, have had 2-week wait referrals sent, safety netted, given information leaflets, been diagnosed with cancer and had cancer care reviews completed. Within your practice, you can also see data about who is registered to use See the Signs and your most common cancer referrals and cancer investigations. Lastly, on this page, there is a section where you can document your reflections and actions either as a practice or as a PCN. This will allow you to document any peer-to-peer learning you have to look at your cancer performance as a PCN or a practice. Anyone from the PCN will be able to see any reflections and actions that you have documented together. So that is a quick overview of See the Signs and how the features can help you achieve your PCN DES and QOF outcomes going into 21-22. If you would like to know more about See the Signs or have any questions, please complete the online form on the South West London website you have just come from, or contact training@seethesigns.co.uk. Thank you.